Hi, Nico. How you doing today?
I'm doing good. How are you?
I'm good. I'm good. We're just going to talk about some complications that you might experience with your drain as you're going home tomorrow.
All right.
So there are some complications that you want to check for, just because it can really prevent ER visits or like healing and whatnot. So because those complications, if they get really bad, that is not good.
Yeah,
and we want to prevent that, right?
I agree.
Okay, so there's a few different types of complications. I have the list here with a checklist here that you're going to use to check out every day that you check your drain. You're going to look through that list, see if you have any of those experiences. So you're going to check for redness and swelling around the insertion site. So when you look at it, like when you're changing in the morning or something, just take a look at it in the mirror, see like that. As well, you want to just check and see if there's any blockages in the tubing. So if there is, or if the drain, if it's suddenly stopped draining and there's no fluid, you just want to keep an eye on that as well. You also want to make sure that it's not getting dislodged. So when you look at the site, when you're changing the dressing, you just want to make sure that the tube is staying in place and the suture hasn't come undone. Because if it does, that is a problem. Okay. So that list, like I said, has all the instructions that you need. So, for example, if you see any redness or swelling, what are the things that you're going to do?
Well,
according to that list.
Of course, I'd be checking my wound, seeing if there's anything else, and I'd for sure be calling my doctor.
Yeah, okay, great. If you notice that the drainage has really stopped, what are some things that you might do in relation to fixing that issue?
Well, I could check my tubing to make sure it's not kinked anywhere, and I also would make sure that the tube is actually still in me, and then I would call my doctor as well if I couldn't solve it, and also like make sure that the pressure is proper, like it's squeezed.
Great. And kind of like I said, with it becoming dislodged, that's a big problem. So what is something that you could do to fix that issue?
Well, call a doctor, go to the ER, they can fix it for me. Just make sure I don't do anything that can pull on it to pull it out.
Great.
I was curious about the color of like the fluid that gets drained.
Yeah, so if you also notice that the drainage color has changed suddenly, because it should be that color, kind of like that brown liquidy type color. But if you're noticing that there's like a lot of blood in it or anything like that, that's something that you want to make note of. So if that changes suddenly too, you can call your doctor as well. Okay. And just like I said, with the dislodgement of the tubing, just try and grab a gauze pad that we're going to give you, and you can just hold it there while you go to the doctor or go to the hospital to get that checked out.
Okay, so hold a gauze pad to it if it's getting dislodged.
Yeah, you just don't want to have it caught anything to pull out anymore.
All right.
Does that all make sense?
Yeah, that makes sense to me.
Awesome.
I think I got it down, and I'll look at the sheet if I need any more help if I forget.
Awesome. Great job.